Hospital and healthcare settings is a very, very good example of the twin benefits that Aircuity solutions can provide to those facility owners. Yes, we can make those spaces more energy efficient, but as importantly, we can deliver safe patient space, operating room space, so that they're not putting any of their patients at risk.
St. Francis is a 617-bed teaching hospital located in Hartford. We have 2 campuses and 2 licensed facilities. The regulatory agencies that would come in periodically needed more data from us so that we could monitor what was going on there. We became familiar with Aircuity and as such installed it in all of our return systems in the OR so that we could get accurate, real-time temperature, humidity, small and large particulate readings, and more importantly, trend these readings to show what we did if there was a problem, to justify the temperature, humidity in an OR if a regulatory body had any questions during their visits.
Healthcare facilities are interested in reducing their incidence of hospital-acquired infections. Aircuity can actually help with that by monitoring the filtration effectiveness of their air handling units.
The Aircuity system provided us several features, including the ability to monitor that data continuously and to look back in time. The web interface and the information being stored off-site allow us to be able to research different aspects of the environment.
The Aircuity Knowledge Center and reporting will actually help our infection control people to focus on the right thing and not have to focus on a question of whether or not the air quality had something to do with the issue at hand.
The information that's logged in the data center is used either by my staff directly in the clinical engineering realm, or we take that information and help to interpret that and bring it to both the clinical end users, the nurses and doctors that are in the room, as well as the infection control department.
We provide them with the indoor environmental quality of the various spaces, and you can start to get almost a blueprint of how the airflow is occurring throughout the hospital. So this can really help them understand the airflow dynamics in the hospital, and also understand the potential causes and improvements that need to be made. From an energy efficiency perspective, typically the operating rooms are the most energy intensive.
We can now provide the ability to turn down the airflow when it's unoccupied, but still provide a clean condition. We call it clean standby. And what we then have is a clean environment, but one that's also the most energy efficient possible.
We are operating that room in a situation where the patient will get the best care in the best environment during that procedure.
Another great example where Aircuity is used within the hospital environment is in lounges and waiting rooms and the emergency room, where there's ventilation requirements for those environments, but it's really related to the number of people involved. So we can then vary the airflow directly based on the amount of people in the environment and provide both a healthier environment by providing more airflow when needed, but also backing it down when it's not.
It's been extremely beneficial, not only for our ongoing real-time data collection, but for regulatory review, and also in our attempt to be energy efficient moving forward.
In every case, we're able to provide at least 2 benefits, one very directly financial, the other that's really aimed at the safety and comfort and productivity of the occupants of that building.